Well, both the House and Senate have passed health care bills, but that doesn't exactly seal the deal. In fact, not by a long shot. The next step could be the hardest, reaching a compromise between the Senate and House versions of reform, getting both plans in sync. No small hurdle. So what will the final bill eventually look like? Let's bring in Congressman Tom Price. He's a Republican from Georgia, also a doctor, and Congressman Eliot Engel, a Democrat from New York. He's a member of the Health Subcommittee. Gentlemen, thank you very much for talking to us.
Thank you, Julie.
Okay, so a long way to go is how we describe how the Senate Democrats and Republicans need to go. Republicans at this point are completely against it. So you have not one Republican in favor of this health care reform bill. Congressman Engel, why don't you tell me first how Democrats plan to outline a strategy that will somehow appease Republicans, come up with a compromise without angering the liberal House members and the Senate Democrats and independents who finally gave final passage to their bill on Thursday morning?
Well, I think that we will have a compromise between the House version and the Senate version probably within the next 5 or 6 weeks, perhaps even in January. We have gone a long way in promising the American people comprehensive health reform, and we believe that it's right within our fingertips. There are differences, obviously, in the Senate and the House packages, but the main thing is similar. We want to make sure that almost all Americans are covered by health care insurance. We want to make sure that no one is denied any kind of health coverage because they lose their jobs or change their jobs. We want to keep the costs of premiums down. We don't want people to be denied coverage because of pre-existing conditions. We don't want the insurance companies making these decisions. And so those are similar things in both the House and the Senate bills. Now we just have to iron out the details.
And Congressman Price, keep the costs down, but for whom? House leaders have proposed a surtax on millionaires. Aides say that they may settle for an expanded version of the Senate's proposal to raise the Medicare payroll tax on annual incomes exceeding $200,000 for individuals, $250,000 for families. Many will argue that doesn't necessarily make you a millionaire if a family earns $250,000 a year. I mean, who's going to wind up carrying the burden of this multi-trillion-dollar bill?
Well, that's the real question, Julie, and that's what the American people are asking. And what they also want to know is whether Democrats are going to represent their constituents or whether they're going to represent their leadership. If they represent their constituents, we'll be just fine. But at this point, both the House and the Senate bill have increasing taxes, $500 billion plus of increasing taxes, $500 billion about in slashes and cuts to Medicare in order to pay for what Eliot says is necessary, and that is appropriate insurance reform and making certain that the costs stay down and making certain that health decisions are made where they ought to be made between patients and families and doctors. The good news is you could do all that without the government taking over the whole show, which is why the American people have said, we don't want this plan, go back to the drawing board.
Congressman Engel, do you agree that the government is going to run the whole show?
Government's not running the show, and let me say to Tom that when Republicans were in control for 6 years, controlled the presidency in both houses of Congress, there was ample time there to make health insurance reforms. So if it was such a good deal to do it that way, why wasn't it done then? We think that the current system is not sustainable, and people who say, well, I just like my insurance the way it is and I want to keep it, will not be able to keep it because premiums are doubling and tripling and going up every single year. And there's been so much misinformation put out about these bills that no wonder the American people are scared. We think when the American people understand what's in the bill, that there will be portability, that people will be able to be insured, that they won't be denied coverage, that if they lose their jobs, they'll keep their coverage. We think the American people will like what they see.
Congressman Price, I'll let you respond.
Yeah. Thank you so much. The fact of the matter is you can do that again without the government taking it over. And I would suggest that Eliot just read the bill. It's not my opinion. It's in the bill. The fact of the matter is what the House bill does, what the Senate bill does, is takes medical decision-making away from patients and families and doctors and moves it over to the federal government, to the Comparative Effectiveness Research Council and other entities. As a physician that I practiced for over 20 years taking care of patients, I know that's not what the patients of America want. Now, again, the good news is there are wonderful solutions that don't require putting the government in charge. That's why I challenge Eliot and the Speaker and Senator Reid to get back to the drawing table and let's work together and come up with the the appropriate common sense solution to the health challenges that we face.
Is it really, though, the concern of senators and congressmen what the American people want? Because the polls say that they don't necessarily want this, and a lot of politicians have said whether they like it or not, they're going to get it. And when they do, they'll eventually like it, but it's not going to be until, I guess, 2011, once once the health care bill passes, essentially. 2011 is when the changes will take place, because a lot of these health care packages that we have under our employers run from, let's say, January to December, and we won't be seeing changes for another year anyway.
Well, look, the American people have been fed a steady dose of lies and distortions. I'm sorry that Republicans made an early decision not to work in a bipartisan fashion on this bill. I mean, it would be a lot better.
Which is true.
Well, it is true, because you see there's no votes. There was no attempt. I'm on the committee. There was no attempt for the Republican side to put their heads together. Of course, we would be better off passing bipartisan legislation, but the Republicans wanted this bill to crash and burn and made a political decision not to support it, and instead put forward a lot of misperceptions about it. The fact is that the Republicans wanted this to crash and burn to help them politically. The insurance company doesn't want it because they like the system just the way it is now. And if we could go back to the drawing board again, Tom, with all due respect, why wasn't it done 6 years ago when you guys were in control of everything? Why didn't you do it then?
Congressman Price.
Again, Julie.
Congressman Engel, I'm sorry. Go ahead real quick, but then I'm getting a hard wrap here.
As a physician, what we say is, what we know is that the status quo is not acceptable. Positive reforms are possible. We tried. They wouldn't allow it. The fact of the matter is the American people are demanding not to pass the bill that's on the floor. Congressman Price and Engel, thank you very much for talking to us. We appreciate your fair and balanced debate here. Thank you.
Thank you.